Welcome back to Monday's edition of Rise and Shine. Of course, Monday we are dealing with health and medicine on Rise and Shine. And of course, this time around, it's the same. Now, these days, we have talked about it being the rainy season. And with rain in Sri Lanka, unfortunately, the dengue menace follows. And we're going to be talking about this particular subject here on Rise and Shine. And we brought on an expert who is a very familiar face to Rise and Shine viewers. And of course, he's an expert in this regard in all sorts of ways. And Dr. Priyankara Jayawardena is in the studio with us. Thank you for joining us, and it's great to have you. Good morning.
Good morning.
Good morning. Dr. Priyankara, this time around, dengue situation, is there something different? Is there new strains coming about? Is there something different about this time's dengue effect? Or is it?
Well, this time, this after the rainy season, we expect many dengue patients as usual. Dengue, there are 4 subtypes in the viral, type 1, 2, 3, 4. And we are very familiar with the 1 and 2, and we may be thinking the type 3, which is a different type, may be coming, but we are not very sure yet. But, we experience little difference in the presentation of these patients compared to the previous years. Especially this time, people get fever. Usually it lasts for 4 or 5 days, but we see lots of patients who come with fever, but the fever lasts only 1 or 2 days, then the fever subsides. We can assume that's a good thing, but when it comes to the dengue management, there's a danger with that, because if somebody gets fever, and when they feel okay in 2 days' time, they tend to go to work and they tend to relax about the illness. The danger is without fever, the other parameters like the platelet count, they are coming down, and then there's a possibility that we could get very sick and critically ill patients in the hospital, because people tend to neglect that as they don't have fever and they relax at home, or they may not seek medical advice.
Definitely. And also, doctor, from your point of view, how would you advise on people seeking institutional care, institutional help? How necessary is it to go to a hospital to get treated, and what are the borderline indicators that you should either stay at home or you should get medical treatment?
Well, when we suspect dengue, basically what we used to say, if somebody gets high fever, body aches, joint pains, headaches, and pain behind the eye, always we have to suspect dengue. And first thing is they should rest at home. If the school children, we should not send them to the school or extracurricular activities and sports, and the adults, they should not go to work and they should not exhaust, they should rest at home. When it comes to the investigations, we have blood counts, and we can do dengue antigen test, especially the day 2, the second day of the illness. But we should understand dengue antigen could be negative and still it could be dengue. So most of the people, when they realize dengue antigen is negative, they think they don't have dengue, which is very wrong.
What is the occurrence rate of a false positive? What are the frequencies?
It's very difficult. We don't have statistics about it, but at least my personal feeling is nearly 50% of the cases dengue antigen is negative, though they are having dengue. So if somebody is having those clinical features of similar to dengue, though the dengue antigen is negative, still they have to assume that they have got dengue. So the other thing is the full blood count, especially day 1 or day 2, the full blood count will not give much benefit to the patient, apart from that, the fact that we know what is his baseline platelet count, and there's another parameter we go with the dengue management, packed cell volume. So if somebody do a full blood count day 2, then we know what is the basic, baseline of those 2 values, the platelet count and the PCV. So ideally they should rest at home take only paracetamol to relieve the temperature and body aches, and they should drink fluid accordingly, especially for adult one, roughly 50 kilograms in weight. They should drink at least 100 milliliters of liquid, that is water, maybe candle and fruit juices, etc. And every 2 hours they should pass urine and monitor the urine output. When somebody drinks 100 cc per hour, they should pass 100 cc of urine for 2 hours, half of the amount. And they should do full blood count daily. And when the platelet count coming less than 150,000, they should come to the hospital. Because sometimes we see patients, today the platelet count is 130 and next day it could be 60,000 with complication. So the drop of platelet count could be very, very fast. So they need once a day or twice a day full blood count. When they realize the platelet count is less than 150, they should come to the hospital and get admitted. The other thing, if somebody gets dengue antigen positive test, that doesn't mean they should come to the hospital and get admitted for medical care. They could do the same thing at home, the rest and the fluid and taking paracetamol and monitor the platelet counts daily. When the platelet count is less than 150,000, then they should come to the hospital for close monitoring.
Now, doctor, in Sri Lanka, when you get an illness such as this, some people go for holistic remedies that sometimes do more harm than good. What are the treatment options that people should absolutely avoid when they have dengue?
Well, when it comes to the treatment options, we feel that the Western medicine, the hospital, the medical guideline and what we practice is correct. And I don't think people should go to a kind of alternative treatment course when there's a reliable way of treating them. Especially they should avoid the strong painkillers, what we could say non-steroid anti-inflammatory drugs like diclofenac sodium, ibuprofen, mefenamic acid. Those are strong painkillers. When people get high temperature, patients, they expect quick recovery and they go to a doctor and they insist strong painkillers and strong medicine, which is very wrong. And the doctors also should not, especially the family doctors, should not prescribe strong painkillers and that kind of medication to control the temperature and control the body aches, which could be very harmful to the patient. Other thing, the steroids is not good because these NSAIDs like diclofenac, mefenamic acid and ibuprofen, those medicine and the steroid. If somebody get these things in the early part of the illness, there's a high chance that the disease could be very dangerous. The patient might end up with internal bleeding, the internal leaking of fluid, and to save that patient's life could be very, very difficult. When it comes to the herbal therapy and other therapeutic measures, I don't think it's it's advisable because especially the people tend to get papo juice and things like that, and there are not much of studies about it, scientifically proven studies. And we believe when somebody takes especially papo extracts, because of the enzymes and hormones in those things, the people tend to get more chance of bleeding and devastating complications. So there may be research that those things put the platelet count up. In dengue illness, platelet count is not the problem. There is no need to push the platelet count up. We feel the deaths due to dengue is due to leakage of fluid inside the body, especially to the lungs and the tummy, the abdomen, and because of the internal bleeding. So the platelet count and those two factors there's no relationship. So to prevent bleeding and the leaking, this herbal medication still there's no proven benefit. So we strongly recommend people not to go for those medications. The people who prescribe those things and they don't take the responsibility when things are not in good shape, they send the patient to the hospital. And then somebody might ask why these medications are very popular among the people. When we take dengue illness, most of the time it's simple and there's no complications. If you take 10,000 patients with dengue, nearly 8,000-9,000, they recover without any complication. They get only fever, just body aches and joint pains, no complications. So only maybe 1,000, no less than 1,000, go to complications like fluid leakage inside the body. Very low percentage, maybe 100 or 200 out of 10,000 goes to a situation like internal bleeding. So if somebody treat 10,000 patients, that's a guarantee. 8,000 will be cured without any problem. That 8,000 means that anyway they recover without any problem, even without any medication. So people think I got dengue and I got this medication, I got cured, which is a false belief. Anyway, that percentage anyway they will be cured without any medication. So we are talking and we are focusing about the group, a small percentage we go to complications, and that is the percentage. There's a small group that could end up with even with death. So we strongly advise to rely on the Western medicine, and all the hospitals in this country are geared to treat dengue, and we have one national guideline which we update every year. Even yesterday we had a lengthy discussion about the recent developments of the illness and the changes what we do for the guideline, and the doctors and the nurses and the health staff and the ministry, and they are ready with these recent updates. So I think the people should give confidence with Western medicine, and we are capable of treating dengue. And though lots of patients get dengue, and the death rate is very low. Last year we were able to reduce it to nearly 50 patients
from the
year before. Whole year. Yeah, 2017 we had a bad time. We had nearly 500 deaths, but 2018 it was 75 or something like that. So, which is a reasonably good figure comparing to the number of patients who had dengue. And this year, hopefully, it will be less than last year.
Definitely. And also, Doctor, something that happens is, this is also something that a lot of people talk about, is that in a family, if one member acquires dengue, what is the tendency of the same family member getting it? And sometimes you prioritize one person in their healing process, that the other person's health could be compromised. What are the chances there?
It's like this, these mosquitoes, the Aedes mosquito, there are two types. These dengue mosquitoes, they need blood. They don't depend on fruit and the plants. So there's a possibility one mosquito is infected with dengue virus could bite many people same time to take a blood meal. If three people are living in one room, the same mosquito who is infected with dengue virus could bite all three people, and all three could get the dengue simultaneously. Or one person get dengue, and if he is not isolated with the mosquito net, there's a possibility that mosquito comes, the Aedes mosquito bite that person, and subsequently mosquito get infected and then bite the other person and transmit the disease. Why everybody don't get the disease in the same extent, we think there's a difference in the immunity. And I told you that the platelet count is not the fact, it's the fluid leakage inside the body, and the bleeding inside the body causing the shock is the reason for the death. And this is, we feel there's a difference in the immune system, the body system react in a different way. So though 3 people get the dengue and 3 are behaving in 3 different ways, one may be very susceptible and could end up with internal leaking and the bleeding. The other person may be just body aches and mild fever. So we think there's a fact in immunity also playing in this illness.
Okay.
Now, doctor, these days I think a lot of people search for vaccines and stuff. Every time dengue comes about, there is articles are written about new curement options being explored, and there are a lot of studies being done, and of course because of the attention dying away, we don't hear about them. Are there any new developments in that regard in treatment options?
Well, dengue is an illness where nearly 25 to 40% people die every year with dengue worldwide. So it is not confined to Sri Lanka, but it's mainly in the Asia, Africa, that belt. Dengue vaccine, many countries and companies trying to produce a successful vaccine to the dengue. 3-4 years ago we got one, but that vaccine was not very successful, and we thought it's not ideal for our country because in Sri Lanka the dengue there are 4 types, and what we used to have type 1 and type 2. That vaccine was mainly focused in type 3, and we thought it is not the ideal vaccine for secondary prevention. Secondary prevention means if somebody gets dengue, if he is given the vaccine, and again the person gets infected with dengue, the outcome may not be very good. So that considering many factors, we thought it is not ideal to Sri Lankan situation, and in worldwide also it was not a successful vaccine. So there are some research going on. Hopefully vaccine comes in next few years, because considering our experience and situation in our country and the weather pattern, it can be done, but it's little difficult to control dengue completely. So we need a vaccine, but until such time we need the support from the community, the government, Ministry of Health, and the doctors and nurses. We can't do the control aspect. What we could do is when we could treat them when they come to the hospital. The important thing is the control and the prevention. So the household prevention and controlling the mosquitoes, controlling mosquito breeding places, that has to be a different task, and the whole country and everybody needs commitment from that. And last year we had, comparing to 2017, 2018, the death rate and the dengue episode was better, rather compared to 2017. Last year we had a good commitment from the people and community, and especially media, and you guys came and to the streets and cleaned the places and gave the good publicity. So it was very helpful. So hope that you could do this time also.
I think prevention is the best course of action against any disease rather than treatment and all that stuff. I think that's a very important message. Coming to you now, these days, of course, apart from dengue, there's a viral flu going around. So how do you differentiate that from dengue? What are the key differences?
Well, if somebody gets fever, headache, joint pain, muscle pain, pain behind the eyes, we have to think it's dengue. We get atypical presentations also. Sometimes people get skin rashes and skin patches, maybe a bit of a bleeding from the gum and passing blood stain, urine, those things also comes with dengue. And sometimes the people come with diarrhea and confusion and sleepiness, and those things also are kind of atypical presentations in dengue. Asthmatics, a person who has asthma, if they get dengue, the asthma symptoms could get worse. So dengue is the killer. So we have to exclude that first, and we have to keep that the back of mind whenever somebody gets fever, whether it's dengue. Though the platelet count is normal, though the dengue antigen is negative. Apart from dengue, the infection around is the influenza. The presentation more or less same. They come with fever, muscle pain, joint pains, headache, plus cough, sore throat, and nasal discharge. So if somebody is getting those features, then we have to think about the influenza. Apart from dengue and influenza, all the other infections also possible. For example, in an area where the agriculture is common, or if somebody is exposed to a collection of water, like the rat fever, leptospirosis, and typhoid is common, and there's a gut infection going on these days, so other bacterial infections also possible. But usually we give the priority to dengue because dengue is the real killer. Others we could do something, though the presentation is little late. In dengue, if somebody comes late and if the person was not treated properly in the initial part of the illness, things could be very dangerous. And comparing to the other illnesses, the dengue is a very dynamic illness. A person's the clinical stage could change very rapidly. So from night to morning, overnight, the situation could be irreversible, change to an irreversible stage. So it's very important to seek the medical advice. And in this country, the practice is whenever a person gets temperature, he wants quick recovery. And dengue usually it lasts 5 to 7 days. So there's no shortcut. And people should not go and ask medication from doctors for quick and fast recovery, which is very wrong. And the doctors also should not give that kind of medication to get popularity or to improve their private practice and things like that. And people should aware, it's a viral infection, there's no antibiotic for those things. Another thing, person who get temperature or fever going to a doctor doesn't mean that he needs lots of tablets and capsules. He goes to a doctor for opinion. So we have to change the culture. So whenever a person gets sick, if they go to a doctor, they expect lots of medication, tablets and capsules and antibiotics and various type of medication. So the culture should be that somebody gets sick, they go to a doctor, family doctor or consultant or hospital to get an opinion, to just do what is it, and to satisfy with minimum amount of medication. So we are in the top list of the antibiotic resistant in the world. So that is because of the same culture, and the deaths due to dengue also happens because of the same culture. People take antibiotics, strong painkillers, and they stay at home and come to the hospital late. So we have to think in a different way.
I think that's a very important step. I think there is a perception that if you're going to the doctor, sometimes you're considered weak, and if you're staying home for too many days, you're considered weak. I mean, those pressures are there around. And do you notice that in the patients who come in late for those type of illnesses?
Well, yes. Sometimes, it could be very dangerous, especially the pregnant ones. After the delivery, they could get dengue due to two reasons. One thing is that when they were in the hospital, they could acquire dengue, maybe from another patient, or in the hospital environment. Or when they go home, they get dengue from the home environment. So, and when a pregnant mother after the delivery, when they go home, if they get fever, they don't come back to hospital soon because of the newborn baby. And sometimes they do a urine full report. It says few pulses in the urine after the delivery, 10, 30, 40 pulses in the urine could be normal. And if they do a blood test called C-reactive protein, it's a mark of inflammation. Usually it's normal in dengue, but after the delivery, because of the childbirth, it could go up. So because of those reasons, and because of the culture, they think that how can I go back to the hospital with my newborn baby? They don't come back to hospital soon. So sometimes we are facing very, very difficult situations, especially the mothers just after the delivery. When they get dengue, they come to the hospital very late. Other thing, because of the children are, there's a the competition among the children for the exam, so they don't come to especially when there is a exam is like August, the A-level is coming. So the children, when they are preparing for those exams, when they get temperature, they don't come to the hospital. And the working crowd, they are pressed with the leave and work commitment. They tend to get some medication, and especially the strong medication like diclofenac sodium and those things, and they get those things and go to the work, and they come to hospital